Welcome to Lecture 8 of our journey through the body's vital organs. Today, we address the topic that touches nearly every family: organ cancers. Cancer is not one disease, but hundreds, each with unique behaviors, risk factors, and outcomes. Yet within this complexity lies a powerful truth. Prevention and early detection transform outcomes. Let's explore how knowledge becomes your greatest shield. Cancer begins when a single cell's DNA is damaged, causing it to divide uncontrollably. These rogue cells accumulate into tumors, invade nearby tissues, and can travel to distant organs. Your body produces abnormal cells daily. Your immune system normally finds and destroys them. Cancer develops when this surveillance fails. Sustained proliferation. Cells keep dividing when they shouldn't, evading growth suppressors, ignoring stop signals, resisting cell death, refusing to die when damaged. Angiogenesis. Building blood supply to feed tumors. Invasion and metastasis. Spreading to other areas. Genomic instability, accumulating more mutations. 1 in 8 women will develop invasive breast cancer, most common cancer in women worldwide. Men can develop breast cancer too. Age increasing after 50 is a risk factor. BRCA1, BRCA2 gene mutations also play a role. Family history can increase your risk. Dense breast tissue is another risk factor. Early menstruation or late menopause can affect risk as well. Never having children or a first pregnancy after 30 is significant. Hormone replacement therapy can influence risk. Alcohol consumption may increase your risk. Obesity after menopause is a risk factor too. New lump or thickening in breast or underarm may be a sign. Swelling of all or part of breast is something to watch for. Skin dimpling or nipple pain should not be ignored. Redness, scaling, or thickening of nipple or breast skin can be early signs. Self-exams are crucial for monthly awareness. Clinical breast exams by healthcare providers are important. Mammograms should begin at 40 to 45 based on guidelines. Breast ultrasound is essential for dense breasts or follow-ups. An MRI may be necessary for high-risk individuals. A biopsy is needed for a definitive diagnosis. Strategies to maintain a healthy weight can help prevent cancer. Limiting alcohol to 0 to 1 drink daily is wise. Breastfeeding, if possible, is encouraged. Regular exercise of 4 or more hours weekly is beneficial. Knowing your family history can aid in prevention. Consider risk-reducing medications if you are at high risk. Lung cancer is the leading cause of cancer death worldwide. 2 main types exist: small cell and non-small cell lung cancer. Smoking accounts for 80 to 90% of cases. Radon exposure is a serious risk factor. Occupational exposures, like asbestos, matter too. Air pollution can increase lung cancer risk. Family history plays a role in lung cancer risk. Previous radiation therapy can heighten risk as well. Signs of lung cancer may start off silent. A persistent cough that worsens could be a warning sign. Coughing up blood, even a small amount, is critical to note. Chest pain with deep breathing or coughing should not be ignored. Hoarseness and shortness of breath may indicate lung issues. Unexplained weight loss and recurrent pneumonia could signal lung cancer. Screening options include low-dose CT scans for high-risk individuals. Chest x-rays are less sensitive but can be used. Sputum cytology and biopsy options exist for diagnosis. Prevent lung cancer by not starting or quitting smoking. Test your home for radon exposure. Avoid occupational hazards and use protective equipment. Regular exercise and an antioxidant-rich diet may reduce risk. Colon cancer is the third most common cancer worldwide. It is increasingly diagnosed in younger adults. Age is a significant risk factor, especially after 50. Inflammatory bowel diseases can increase risk levels. Family history of colon cancer or polyps is important to consider. Genetic syndromes, like Lynch syndrome, matter too. Diet high in red and processed meats raises risk. Low fiber intake is another factor to consider. Obesity and smoking also contribute to colon cancer risk. Heavy alcohol use and type 2 diabetes can play a role. Changes in bowel habits should not be overlooked. Blood and stool, whether bright red or dark, can be a sign. Narrowing stools and abdominal discomfort should raise concerns. Feeling of incomplete evacuation and unexplained fatigue matter. Screening for colon cancer is vital for early detection. A colonoscopy is the gold standard starting at age 45. The FIT test is an annual stool test you should consider. CT colonography is another screening option available. Biopsies can be performed during colonoscopy for diagnosis. High-fiber diets of around 30 grams daily are ideal. Limit red and processed meats to reduce risks. Regular exercise is recommended for everyone. Maintain a healthy weight through balanced life choices. Limit alcohol and avoid smoking, which are both crucial. Ensure calcium and vitamin D adequacy for health. Discussing aspirin or NSAIDs with your doctor may benefit you.